Welcome to another edition of Inside Cottonwood. I'm Ron Corbin, Cottonwood City Manager, and we are fortunate to have a couple fine guests today. We have our Chief of Police, Chief Gesell.
Hello.
How are you doing?
Good. How are you?
Good. And then we have a special guest today. I'm very excited. Drove all the way over from the other side of the mountain, and we have Paige LeForte, who is the Director of Clinical Services with Spectrum.
Yes.
Welcome. So today's topic, we're going to talk about September is Suicide Prevention Awareness Month. And so I wanted to take a few minutes today and talk about this issue in our community, in our state, and in our nation, provide some insight and hopefully provide some resources towards the end about where people can go to get help. But Paige, why don't you talk a little bit about yourself and a little bit about Spectrum and maybe some of the services that are offered?
Absolutely. So like you said, my name is Paige. I am a Prescott born and raised local for a couple generations now. So
Wow.
This community is near and dear to my heart. My family's very ingrained here. I have been doing community mental health for the last 15 years, 10 of which have been specifically in crisis intervention. So this is my niche in the world. I've been with Spectrum for 2 years, but Spectrum as a whole is more ingrained in the community than I've been alive.
Right.
We were previously the Verde Valley Guidance Clinic. We've been around since 1965, and we are a fully integrated health home, which means that not only do we provide behavioral health services, but we provide medical care, pediatric care. We see ourselves as a one-stop shop for whole person care, for mind, for body, for all of you. That's how we're seen. The current departments that I'm over primarily is the mobile crisis team, which fits in really well to our topic that we're discussing today, because our primary goal is suicide prevention, and that's the primary calls that we respond to in the community with our law enforcement partners and in the area as a whole, is to prevent suicide.
Well, that's a handful, and the whole body, whole mind thing I really like. In a full disclosure, I'm a patient of Spectrum Healthcare. I get my health care over at the Cottonwood office there off of Mingus, so you got some great providers there. Nurse practitioner, Claudia Converse might be a great provider that is employed by your organization. No, I love it. So I'm kind of making light of a great organization. But Chief Gesell, you guys work very closely with Spectrum. Do you want to say a few nice things about them and your working relationship with them?
I am never short of nice things to say about Spectrum. As you know, I've been here in the Valley, Verde Valley, for about 5.5 years, and one of my first meetings to establish some of the partnerships that we needed through the law enforcement perspective was with April Now Rhodes. The CEO, is that her title, of Spectrum, just phenomenal lady and a phenomenal community partner. And it's never really wavered. That partnership has never wavered since that moment. It's only gotten stronger, as exemplified by our partnership and collaboration with Mobile Crisis, which I'm guessing we'll touch on a little bit later. But great community partner. We're very, very fortunate to have them. Oh,
very good. So, Paige, Suicide Prevention Month's another one of those months. There's Heart Health Month, and next month's a month for around here, Cancer Prevention Month. I haven't seen the shirts yet, but usually our fire department does a shirt, and we have all sorts of neat stuff going on. But why is this important? I mean, what is the goal of having a Suicide Prevention Month?
I think the same with other months and days. It's to bring awareness. I mean, suicide is prolific in not only our area, but in our nation, and has been for a long time. And until attention is paid to that, we won't see a reduction in those numbers. We've all gotten very used to the 22 a day, right? That is the phrase we hear when it comes to veteran suicide. And that has become prolific and actually reduced the number of veteran suicides. And so by creating awareness and events and months and days that are dedicated towards professionals and industries mitigating these circumstances, we're able to greatly affect change in our communities.
That's amazing. I hadn't thought, I've seen the bands and the t-shirts and heard a lot about 22 a day, but you say it as actually making a difference in veteran suicides or reduction. Very good. So why Cottonwood or Yavapai County? You provide services to most of Yavapai County. So what is it, a crisis here? Is it Prevalent, just talk about what the issue is here in Yavapai County.
Fortunately, in our area, I feel like Yavapai County has been very progressive in its sorts of dealing with suicide and providing mental health care, such as partnerships with Cottonwood Police Department. You know, we've been doing this longer than some other people have,
right.
So we've been on the ball with this. Does that mean we have solved the problem? No. They actually just put out our last year of statistics for Yavapai County, and we are missing the mark in some areas. The most prevalent time suicide occurs is in the geriatric population, and Arizona is one of the worst in the nation for that. It's ages 50 and up, and the most common method is through firearms. And so that is, although we seek to alleviate and prevent anything we can see by the facts that we still have a lot more work to be done.
Yeah, so Yavapai County is one of the oldest counties in the state, and this area over here is some of the oldest. We, Cottonwood, are the youngest in the valley, but between Sedona, Camp Verde, and Clarkdale, the average age is over 50, I believe. So clearly there's a need for us to be able to do more. So we're going to take a quick break. Before we go on break, though, I'll just share a quick story. One of the other reasons that I wanted to talk about this is I want people to intervene. I want people to notice some signs and symptoms, and I want people to know they care. I've lost some very close loved ones over the years. When I was in high school, my uncle committed suicide in the 80s. And then, 5 or 6 years ago, my dad committed suicide. Vietnam veteran, mental health issues, drug problems, lots of things, and lived not near me, lived in Arkansas out there, and the impact it has on the rest of the family is significant. My sister found him, and has impacted her significantly. So the hole that they leave when they leave behind, if they would, I'll ask you when we come back from break, but for me, if they knew the hole they would leave, you'd think that would have made a difference. And so when we get back, we'll talk to Paige about maybe some signs and symptoms and what people can or can't do to help change someone's pathway.
Terrifying jobs, high-flying linemen, take 3.
Josh, this is an absolutely terrifying job. Why do you do it?
It's a very demanding job, but very rewarding and exciting.
How much energy are you actually working with up there?
500,000 volts of electricity.
It's definitely not my line of work. Does anything shock you?
Yeah, distracted drivers terrify me.
Welcome back to another edition of Inside Cottonwood. I'm Ron Corbin, Cottonwood City Manager, and today we have our Chief of Police, Chief Gesell, and we have the Director of Clinical Services, Paige LeForte from Spectrum Healthcare, joining us. And today's topic is a little bit sad. I'm trying to not be so sad right now, but suicide prevention awareness. And when we left on break, we were going to come back and talk about maybe some signs and symptoms, what friends and family should look for. Paige, can you help us out with this?
Absolutely, and I think you started the conversation perfectly, is what do friends and family need to look out for? I think the biggest thing we can forget as we grow farther and farther apart in the virtual world is that the first people to know are the people closest to you. And unfortunately, they're always the ones that seem to miss the signs. And does that mean anybody's doing something wrong? No, but there's just more information to be shared there. The biggest factors we look at are, is there any history of mental health conditions? And that doesn't necessarily mean you sat on a shrink's couch for 10 years and got a bunch of psychotherapy, but do you have a history of trauma? Do you struggle with symptoms like post-traumatic stress disorder? Are you depressed? Are you anxious? What is going on with your health, your physical well-being? Looking for sudden changes in behavior. Did somebody who was previously really outgoing suddenly withdraw? Or did somebody who's very, very isolated suddenly become very optimistic and happy?
Right.
You know, it's all about checking in with baseline, and do they seem different than what we're used to?
Yeah, when you look back again, talking about my personal experience, it was just that, you know, it was like my dad became at peace and was happy again. And so as someone on the telephone and otherwise, you're like, oh, you know, hey, he's finally got it together. You know, he's happy again. And you know, it just was the opposite. He had finally come to peace with his decision and was going in that direction. So, you know, you notice these behaviors, you see the changes. What should a person do?
Call for help. And we create programs such as our mobile crisis team to give community members access directly to help, but also our law enforcement partners are there. If you don't know who to call, pick up the phone and just find a place to start. And we're also interconnected and interrelated, that we're going to find a solution. Take every threat, statement, or comment seriously. And I think it can be something to dismiss, or that we don't want to hang our dirty laundry for everyone to see.
Right.
But if you have a concern, bringing that to a professional's attention, whether it's a behavioral health professional, a medical professional, a first responder, get in touch with somebody and we can get you resources and get people in person to help.
I think that's key. Chief, so if I call 911, what happens if it's a mental health case? I mean, what would you guys do if I called on my dad to check on him, do a welfare check on him? How do you guys interact with Spectrum, and how does that work?
Very common call that police departments receive across the United States, and historically, and quite frankly, in most police departments, even to this current day, we're going to send officers to check on that person's welfare, be it whether they're showing some behaviors that would suggest they're thinking of taking their own life, or they just haven't been seen in a while. Well, those are very common calls that the police department goes on. I think the evolution and the way we're moving, and it's part of some of these national discussions on what should the police be responding to, what should they, is there other professionals that can address some of the more complex social issues that we see more effectively. And that's the reality in policing is, generally speaking, when society really can't, there's really no solid mechanism to address a very complex problem, it's generally left to the police to try to, which is not an ideal situation, obviously, but that's what we're paid to do. And that's part of our mission. But we are evolving in this regard. And as I mentioned before, Spectrum initiated a program tied together with local law enforcement, and we were joking that Cottonwood is their number one customer on mobile crisis response in the county, is what Paige was just telling me. I thought it was just this side of the mountain, but it's no surprise. We have a lot of mental health issues. There's no doubt about that. So many times officers will initiate that call based upon what they encounter and make sure that the scene is safe, that there's no threat to bringing in mental health professionals in the crisis team. But we've enjoyed phenomenal successes and response from individuals that is fleshed out in Spectrum statistics on not only the amount of resources and money that are saved that the taxpayer is not burdened with, through these essentially diverting it away from the justice system, because that's the de facto mental institution, quite frankly, in many communities, and trying to access services that are more effective in helping getting direct help to people that need it, that we are just not equipped to respond. But if I could I play a co-host for a second? Sure. I'm curious, Paige, if you have any. It's weird that I'm switching this up, isn't it? If you have any, I'm interested in the correlation, if there is one, and statistically on, even in Yavapai County, on suicides and drugs. Because I just came from the drug summit, which is sponsored by MapForce, which I sit on that board. Phenomenal organization and just the state-of-the-art training, phenomenal speakers. But I just came from that yesterday, and I want to say we're number 4 as a county in overdose deaths in the state of Arizona per capita.
Wow.
Per capita.
Right.
So I'm curious if we have any either anecdotally or hard statistics that correlate when people take their own lives, what percentage are using illegal drugs or drugs that they're legally prescribed.
Absolutely. So I must preface with correlation does not necessarily equal causation,
Right.
but these are absolutely statistics that we track. And the method that we track them with is what we call social determinants of health. And that is, what are the social factors in your life that increase your risk for suicide? And the top two are substance abuse and homelessness. If you have those two conflicts happening in your life, you are at a significantly higher risk. So we will see that in geriatric populations a lot, and this coincides with what I just said.
Right.
They have access to controlled medications that aren't easily prescribed. They tend to store and hoard medication, and that's also something they have very easy access to. So there's a risk factor of not necessarily heroin, right?
Right.
But to the exact same extent, on the opposite end of the spectrum,
Right.
you have individuals who are homeless, who are addicted to opiates and overdose intentionally as their only means of finding a way out of their situation.
Well, thank you, Chief, for that segue. I appreciate that. When we come back, it's time for another break, I believe. We're going to talk about, in addition to 911, maybe some other resources that people can have to get out. And I do want to spend just a minute talking about self-awareness and if there's anything we can do to keep an eye on ourselves to prevent ourselves to getting to that point. All right, we'll be right back talking to Paige from Spectrum and our Chief of Police.
There are people who struggle with addiction and homelessness. Sometimes it may feel like there is nothing we can do to help.
But there is. You can make a tax-deductible donation and help those in need transition away from homelessness.
When you give someone a handout, you could actually be supporting an addiction.
A better life starts with better health, especially for those living in the streets.
Support solutions, not addictions. You can make a difference. Visit cottonwoodcares.com.
Looking for a ride to Sedona? Hop on the new Verde shuttle at the Cottonwood Library and go everywhere you want to go in West Sedona, uptown and south to Poco Diablo Resort. It's just that easy. Looking for a better way to commute between Cottonwood and Sedona? The Verde shuttle buses are brand new. A cool, clean, comfortable ride for only $2 each way or $3 for an all-day pass. It's just that easy. Check out details at verdeshuttle.com or ask Google Maps for transit directions. It's just that easy.
Welcome back to Inside Cottonwood. I'm Ron Corbin, Cottonwood City Manager, and we are talking today about suicide prevention. September is suicide prevention, and many of us have been impacted by friends and family members who've taken their own lives and felt the hole that it leaves behind. And so hoping to raise awareness, make people aware of the resources out there, make them aware of signs and symptoms of themselves and others, so that they can, save a life. Very important. When we left, we were briefly talking about the correlations. You said not a causation of common suicide factors here. Drugs was one of them. Age seemed to be another one, and then homelessness. And you mentioned that Cottonwood is a significant user of Spectrum services on this side of the mountain. Sure enough, we have an older population. We have a significant homeless population. So I'm glad to see that we have professionals like Spectrum to help our police department, our fire department, and our nonprofits make a difference in our community. Before we go into the actual topic, I believe that our homeless coalition works with you guys. I know that I believe Officer Rep has set up some programming for our homeless to work with you guys. So I really want to just make sure I say thank you to Spectrum Healthcare for working with not only the City of Cottonwood and our police department, but all the other nonprofits that are trying to make a difference to those in need in the community. So thank you. We appreciate that immensely. So I want to start this segment and end this segment with a phone number, just in case. So I believe there's a number somebody can call. Do you happen to have that?
Yes, so you call Spectrum to start, and that's 877-634-
877 634
7333.
7333.
And that will be answered 24/7. So
Okay.
that is not a Monday through Friday business number.
Right.
During business hours, you will connect with someone locally in your area, and that includes crisis services. You will speak with somebody who is 20 minutes away from you.
Wow.
After hours, it connects to Solari, which is the suicide prevention hotline for our area, and they handle dispatching and sending out crisis teams after hours.
Well, very good. And I'm assuming there's no charge?
No, there is no
help?
charge. This is a free to use service because this is a need our community has. We operate a lot on dollars that don't come from crisis interaction because the number one thing I could tell somebody to make it worse was, here's your copay for today's visit.
Well, I didn't want them getting a bill in the mail for making that phone call or anything. And I know people worry about the dollar and the cost of health care, so I just want to make it clear that 24/7 they can get some help if they get to that point. So I want to we'll come back to that phone number at the end, but I want to talk about the signs and symptoms a little bit. And we talked briefly about watching for changes in behaviors in others, but what about self? Is there anything, I don't know I don't know how this works, but is there anything a person can do to keep from getting to that point?
Absolutely. I think one of the big factors that makes my team so unique is I don't believe there's a single person on my crisis team that doesn't have a direct line to experiencing crisis, whether it's through a really close relative or something they've gone through themselves. We can't go out and effectively help another individual if we haven't been taught what to look for in ourselves first. The biggest things I would pay attention to is, are you meeting your basic needs? And that is safety, sleep, nutrition, hygiene. If any of those start slipping, that's an indication something's wrong. Does it mean it's a risk factor for suicide? No, but that's where the trickle effect starts. If I stop showering and then I'm too gross to leave the house, then I'm isolating. And if I'm isolating, then no one knows I'm feeling sad and lonely. And then if I start feeling sad and lonely and I'm not telling anybody, then I'm gonna start thinking about maybe ways to harm myself. And that's gonna continue to escalate. So it really starts with those basic needs. Do you see your doctor routinely? Everyone should be getting an annual physical and having their annual needs checked. Your doctors are gonna screen for this every visit. Do I need to check in with a mental health professional? There is no taboo, stigma, or harm in talking with somebody just to check in. I have some anxiety I'm struggling with. Can we talk about it? And those come in all different shapes and sizes. Again, it doesn't have to be Freud's couch.
Right.
And staying close with your supports. Knowing who you can call, who that emergency contact is for you that I can call and I can say, hey, Mom, I'm not feeling so okay right now. I just wanted to let you know. Because that's going to trigger my support system to be like, okay, we need to pay more attention to Paige right now.
Wow, that's a lot there, but I like the basics. That just makes sense, and I guess that's something you can watch in others as well. On break, we were talking about law enforcement, first responders, talking about a stressful job. The chief and I were actually talking about lunch about a certain job, and 99% of the time that person will never have to respond, but that one time, and he's got to be ready. He's got to be ever vigilant, always on guard, always sharp, and that can get stressful. And then dealing with our community in their moment of crisis. Most police officers don't get the chance to meet people on their best day. Same thing with our fire department and even our 911 operators. So. Do you want to take just a minute and talk about first responders and preventing suicide? Absolutely. I think it's an important topic of conversation that we're also really passionate about at Spectrum, is making sure our first responders are okay too. They are put into a position and a role where they have to be strong and brave at all times and are not allowed to show weakness or have weakness. And the fact that it's even correlated to weakness says enough in and of itself. And so checking in and paying attention to the needs and support we can provide any of our first responders. We've seen that dramatically increase in the last 2 years because of COVID. The amount of stress and strain we are all under and that the systems are having to deal with right now has had adverse reactions. And knowing that anyone, anywhere can ask for help or may need help. It doesn't have to be civilian citizens, the person homeless on the side of the road. It can really be anybody, and checking in with everybody is really important. Don't just assume everyone's okay. Don't assume. Yeah. Chief, do you want to add anything to that? You've been in law enforcement a little while, a few years. Just a few years. And I know you have buried comrades and people, and is there anything you want to add? Yeah, I mean, people are experiencing stressors of all kinds. I mean, the COVID era is an example that we've touched on during this conversation, but when you talk about isolation and all those issues that compound, particularly people that may already be predisposed or vulnerable,
it's very, very much concerning, and I think the statistics bear it out, unfortunately, that it is impacting. So with our profession, I've done this for 32 years. It's the only full-time job I've had, and I've seen the evolution, the focus more so on mental health and well-being of our own, particularly over the time that I've been a police chief, which has been the last 11 years. I don't know what that is in dog years, but it's
a lot.
It's quite a few. But particularly, and that is part of my personal mantra, is being in that particular role, is ensuring that the culture, at least in my organization, has that awareness that we're looking out for each other. Not only are we looking introspectively, but we're also looking out for our teammates, which is historically was not part of the culture when I was a rookie in 1989. But I can tell you that very analogous to a certain extent to our men and women that serve in the military. There's some components that are similar, and some that are very different. A combat theater is quite a bit different than modern day policing, but police officers see some terrible things that have an aggregate total. So that I think escapes the conscience of most people. So it's that aren't in the business, and rightfully so, because it's a job that's very, very frequently misunderstood. But it does take a toll on you mentally, and and physically to a lesser extent, I believe. But we've come a long way in at least that awareness, and even in our own industry, if you will, we have a lot of seminars and mind-body wellness focus that are helping us kind of counter those negative effects that the job brings. Best job in the world, by the way. It has a price. But
yeah, it does have a price. Right. Well, I hope that today, before we wrap up, I'll give you one more chance, Paige, to talk about anything maybe we have missed. Actually, I think we have a couple minutes. I want to talk about one more topic, and then before I start my closing statement. You mentioned, Chief, about the program we've been using with Spectrum and the response. There are agencies across the country that are trying different models and trying to figure out how to get the right response and the right care to the right person at the right time. I heard rumors that you guys are partnering up or thinking about or trying to figure out how to get past the attorneys and the insurance agents to try a new program and really to make sure that our residents, our citizens are getting the care that they need and the proper response that they need. Do either one of you want to? Am I
I'd be
pushing the
happy
limit
to touch
here?
on it. Yes, Spectrum, again, being the phenomenal community partner that they are. When I talk about that evolution, and we talked about what happens when you call 911, we talked about the phenomenal resource we have here in mobile crisis. We ask, and Spectrum asks themselves, and we've considered it as well, what is there a next step? And we believe that the diversion of some calls that come into police departments that are historically dispatched to uniformed officers are better suited for mental health trained professionals from the get-go, considering certainly certain criteria is met. They are not police officers, obviously, and we do not want to put anyone in a unsafe situation. So I never see the replacement. There's no defund. It's an absolute focus on fine-tuning what we've already proven as a success and seeing if we can even refine it a little bit more. So that's what Spectrum is actively engaged in, and Paige, feel free to jump in with discussions with us and other county law enforcement agencies.
Do you want to add anything?
Yeah, absolutely. I mean, we're seeing this wave happen through a lot of different states, through different municipalities across the nation, and it's been a shift for the last couple years about how can we keep officers where they truly need to be, and how can we utilize existing resources in a more effective manner. And because of our partnerships and the relationships that we have with Cottonwood PD, we can have that conversation that's like, hey, what can we do next? Let's push this line a little bit more and see how we can be more effective to meet the needs of our community. Because now now we have 5 years worth of data of every single call we have responded to as a result of Cottonwood Police Department. And we can look at that call and say, was a crime being committed? Was there a threat of safety to self or others? Could a mental health professional have addressed this without the presence of a uniformed officer? And we can take all that data and we can go, okay, we can start identifying calls that we can send a team to on their own. And we've done that anyway for a while, just not directly from police. When people call our office, we just show up. So this isn't new to us, but this is a new way of creating a system in place to get help to people who need it, wherever and whenever they need it.
That's mind-boggling that data-driven decision-making, you know, that you went back 5 years and looked at the data and studying it to figure out when and how this would work. And I am excited about this program. Again, for me, it's about getting the right amount of response to the right person at the right time in their moment of crisis. It's awesome. So is there anything else you want to add before we wrap up this quick 30-minute interview?
No, I mean, the number for Spectrum was posted and it accesses somebody for 24/7. So if at any point in time your loved one is in need of assistance, please call. Our crisis team is available 24/7. So someone in your area will come talk to you in person. It's not, you know, a phone call at all times. So we're always available.
1-877-634-7333. Chief, anything you want to add before we wrap up here?
I think this has been a great discussion, very informative, and appreciate the opportunity.
Yeah, moving it forward. So I'll just end with a little mushy for a city manager, but I want people to know that there are people out there who care, and there are people out there who want to help, and there are free services for those in need. So if you find yourself in a place, please call this number, reach out to someone, activate your support system. If you have one, take care of your brothers and sisters out there, and we will see you next time on Inside Cottonwood. I'm Ron Corbin, Cottonwood City Manager.